In this video, we are going to learn about the ophthalmic preparations. Definition. So, ophthalmics are the sterile preparations which are intended for application to the eyes. They are used for treating the eye infections, inflammations, dryness, and glaucoma, or for diagnostic purposes also. So many types of ophthalmic preparations are available in the market nowadays. What are those? Means eye drops, ointments, gels, eye inserts, intraocular injections, irrigations. So all these are all the various types of ophthalmic products. So let us see some ideal properties required for the ophthalmics. So ophthalmics should be sterile in nature as they are intended to be instilled into the sensitive organ like eye. So they should be sterile in nature. So the most critical requirement is sterility here. So the ophthalmics must be free from all the microorganisms, and this can be achieved by aseptic manufacturings or by the terminal sterilizations. Okay, so here that sterility testing is mandatory for the ophthalmic one. Another requirement is the isotonicity. So the ophthalmic solutions should be isotonic with the tear fluid. So this prevents irritation and discomfort. Okay, and some common tonicity adjusters like sodium chloride, dextrose, and boric acid are generally needed to be used as isotonicity factors here. And next one is the appropriate pH and buffering. So that is the another type of requirement required for the preparation of the eye drops here. So the normal tear fluid pH is 7.4, and acceptable pH range is 6.5 to 8.5. So the buffers are used to maintain the stability of the drug here, and the patient comfort is also needed to be taken into the consideration while preparing the ophthalmics. And here the preservation is also needed for the preparation of the eye drops, especially for the multi-dose containers, and here they will prevent the microbial growth during the storage and also uses also. So here the commonly used preservatives like benzalkonium chlorides, chlorobutanols. So like that we have to be used for both for single and multi-dose containers. And next type of property is the particulate matter. They should be free from the foreign particles, especially for the solutions. Okay, and the suspensions must have a uniform particle size is needed to be maintained, and non-irritating particles are needed to be removed from the preparation. Okay, and the clarity is also needed to be maintained here, and the viscosity is the another type of the factor. So the moderate viscosity helps increase the contact time with the eye here, and the viscosity enhances like HPMC, methyl cellulose are needed to be included in the preparations, and some compatibility and stability, that is ingredients must be chemically and physically stable, are needed to be included in the preparation, and should not interact with the drug substance, and the packing material is needed to be checked here. Okay, so that is check the compatibility and the stability of the preparation. Okay, so these are all the various types of properties required for the preparation of the ophthalmics. And next is the types of ophthalmics. So here so many types of ophthalmics are available nowadays in the market, like eye drops, ophthalmic ointments, ophthalmic gels, eye suspensions, ophthalmic emulsions, eye inserts, intraocular injections, ophthalmic irrigations, contact lens solutions. So these are all the various types of preparations are available in the market nowadays. We will see one by one clearly. First starts with eye drops. First one is the eye drops. So these are available in solutions as suspension form. They are most commonly used for delivering the drug to the anterior segment of the eye here. Examples of the drugs which are used as a eye drops are antibiotics like ciprofloxacin, anti-allergics like olopatadines, and mydriatics like tropicamides are generally used as a eye drops here. And next one is the ophthalmic ointments. So here these are available as a semi-solid base forms. Usually petroleum bases are used, and they are used for prolonged contact time with the eyes and often used at night times, especially at the bedtime, in order to improve the patient compatibility. And advantages of this type of ointments are longer duration of action. That is the main advantage. An example of drugs which are used as eye ointments are erythromycin ointments. And next one is the ophthalmic gels. These are some sort of viscous gel forms, and these are used to increase the retention time without the blurring of ointments. And example of drugs used as gels are timolol gels, carbomer based artificial tears. So this is about the ophthalmic gels. And next one is the eye suspensions. So these are some sort of insoluble drug particles dispersed in a liquid here, is used as a eye suspension. So here they are mainly used for poorly water soluble drugs, and note must be taken that they must be shaken before use. And examples of the drugs used as eye suspensions are prednisone on acetate suspension, which is a poorly water soluble drug. Okay. And next one is the ophthalmic emulsions. These are oil in water emulsion form, and they are mainly used for the lipophilic drugs needed longer action. Examples like cyclosporins. Okay. And next one is the eye inserts. These are also called as occlusets. These are solid or semi-solid devices which are placed in the conjunctival sacs. So these are used mainly for controlled and sustained release of the drugs. Examples like pilocarpine occlusets for the glaucoma. And next one is the intraocular injections, like injectable solutions. These are directly to be injected into the eyes, like intravitreal or intracameral or subconjunctival routes. So these are used for serious eye diseases like macular degeneration, for endophthalmitis. The next one is the ophthalmic irrigations. These are the large volume sterile solution forms, and these are used during surgeries or to wash out the foreign particles. Example, balanced salt solutions. This is called as BSS. Okay. And next one is the contact lens solutions are also available in the market nowadays. These are available as solutions used for cleaning, the disinfecting, and storing contact lenses are available nowadays. And so for contact lens solutions, we prepared one video. Just go through that. And there are mainly of three types contact lens solutions, like a cleaning solution, disinfectant solution, and saline solution. So just go through that video. So this is about the types of the ophthalmic preparations. And next one is the formulation of the ophthalmic preparations. As already told that ophthalmic preparations are the sterile dosage forms which are intended for use in the eye, such as eye drops, ointments, gels. So the formulation is carefully designed to ensure the sterility, isotonicity, appropriate pH, comfort, stability, effectiveness. Okay, in order to achieve all these factors, so we need to use so many kinds of ingredients. So the key components of ophthalmic formulations are the active pharmaceutical ingredient, that is API, the first one. So here it provides the therapeutic effects like antibiotics, anti-inflammatory, anti-glaucoma. So they must be stable and suitable for ocular use. Examples like ciprofloxacin and antibiotic eye drops. Okay. And next one is the vehicle. So vehicle, that is called a solvent also. So usually a purified water is used to dissolve or disperse the drugs and other ingredients here. For oily drugs, example in ointments, a suitable non-aqueous vehicles may be used. Okay. And next one is the pH and the buffers. Normally TS fluid has a pH of 7.4. So the formulation's pH should be close to this for comfort and stability of the drug here. And here the buffer systems like phosphate buffers, borate buffers are also be added to maintain the pH. And next one is the tonicity adjusters. So the solutions must be isotonic, same osmotic pressures as TS to avoid the irritation or damage here. So in order to adjust the tonicity, we are using the tonicity factors. So commonly using agents like sodium chloride, dextrose and boric acid that need to be added. And next one is the preservatives. So these are generally to be added in multi-dose containers in order to prevent the microbial contamination during the repeated use. Okay, they must be effective but not irritating one. So they are not used in the single dose products, post surgery uses and sensitive eyes. Okay, example benzyl ammonium chloride, chlorobutyrols. Okay, and next one is the viscosity enhancers. So they makes the solution slightly thicker to increase the contact time with the eye. So in order to improve the drug absorption and also to reduce the dryness of the drug. Okay, so here are examples for viscosity builders like methyl cellulose, HPMC, that is hydroxypropyl methyl cellulose, and carbopols. So all these are all the viscosity builders are needed to be included in the preparation of the ophthalmics. And next one is the stabilizers and antioxidants. These are used to prevent the degradation of the product. Example like oxidation. So commonly used in the product sensitive to air or light. Example sodium metabisulfides, EDTA, that is the chelating agents. Okay. And next one is the suspending or emulsifying agents. In suspensions, these keeps the drug particles evenly distributed. In emulsions, they keep oil and water mixed together. Examples xanthine gums, polysorbates. Okay, and packing materials. We must have to take care while choosing the packing materials also for the preparation of the ophthalmics, as they are needed to be intended to be highly into the sensitive organ like eye. So we must have to take care for while choosing the packing material also. So must protect the formulation and also to maintain the sterility. So the dropper bottles are commonly used, and some products require the light resistant containers. Okay, for single dose, that is a dropper bottles are generally be used. So that is the most common packing materials for solutions, suspensions and emulsions here. And next one is the ophthalmic tubes. These are used for preparation of ointments and gels. So usually made from aluminum or laminated plastics are generally to be used, equipped with a narrow nozzles for application here. And next one is the single dose units, that is preservative free products, that is made from LDPE or below fill seals. Technologies are generally to be used for preparation here. Next is some sort of glass containers. Amber colored glasses for light sensitive drugs are needed to be used. And blow fill seal technology, that is the modern advanced method, is nowadays using. The container is formed, filled and sealed in a continuous sterile process here. So used for both unit dose and multiple dose packagings nowadays. That is the blow fill seal technology, that is the advanced method nowadays. Okay, this is about the packing materials. And next one is the evaluation of the ophthalmic products. There are so many evaluation tests are needed to be conducted for the preparation of the ophthalmics, like sterility test, clarity test, pH determination, isotonicity test, viscosity measurement, drug content, like I say, and uniformity of the content for suspensions or ointments, and particle size and distribution for suspensions, in vitro drug release, and preservative effectiveness test, and packing and leak test, and weight and volume uniformity. So all these tests are needed to be conducted for the evaluation of the ophthalmics. And first start with the sterility test. This is the most important test. It ensures the formulation is free from viable microorganisms. So there are two types of methods are adapted for the test, like membrane filtration test and a direct inoculation method into the sterile culture media. And here The incubation period is 14 days at 20 to 25 degrees centigrade and 30 to 35 degrees centigrade. Okay, and required for all type of ophthalmic products. So this test is needed for all types of ophthalmics. Okay, and next one is the clarity test. So this is only for solutions, and which ensures the solution is free from viable particles, fibers, or turbidity. So this is needed to be checked by the visual inspection against the black and white backgrounds. Okay, so this indicates the proper filtration and absence of the contamination here. And next one is the pH determination, so which is used for measuring the pH of the product simply by using a pH meters. The ideal range is 6.5 to 8.5, which ensures the patient confirmation of the drug stability. Okay, and next one is the isotonicity test, and this ensures the formulation is isotonic with the tear fluid. So the common methods like freezing point depression method and hemolytic methods are adapted here. So this is used for to prevent the irritation or damage to the ocular tissues. Okay, and next one is the viscosity measurement. So measuring by using a viscometer here, that is Brookfield viscometers. The ideal range is 15 to 25 centipoise for eye drops is needed to be maintained here. And the next one is the higher viscosity increases just the contact time with the eye. Okay, so for that purpose we are conducting this test. And next one is the drug content and assay. So measure the actual amount of the active ingredient in the formulation. So this test is conducted by mainly by using UV visible spectrophotometers and HPLCs, that is high performance liquid chromatographies. So this is used to ensure the correct therapeutic dose is delivering or not. Okay, and next one is the uniformity of the content. This is for suspensions or ointments, as already told, that which ensures the drug is evenly distributed toward the product or not. So the samples from the different parts are to be taken, that is top, middle, and bottom, and simply observe. And next one is the particle size and distribution, which is for suspensions, which ensures the small and the uniform particles less than 10 micrometers. So in order to prevent the irritation and ensures a uniform dosing, we will conduct this test. So this is tested simply by using microscope or a laser diffractions. So next one is the in vitro drug release test, so which stimulates the release of the drug from the formulations, useful in the evaluating the control release or gel formulations, which is performed during the diffusion cell methods. And next one is the preservative effectiveness test, which ensures the preservative in the multi-dose product is effective or not. So the product is inoculated with the test microorganisms, and reduction in the microbial count is observed over the time. Okay, as per USP or IP, we have to follow this test. And next one is the packing and the leakage test. So verifies the integrity of the container. We will conduct this test, and which ensures no leakage. This test mainly ensures no leakage, proper sealing, and protection from the containers. Okay, and next one is the weight and the volume uniformity. So ensures consistency in the dose delivered per container, especially important for the unit dose packing. So we will conduct this test. Okay, so this is all about the various evaluation tests for the ophthalmics. And next one is the application of the ophthalmics. The ophthalmic preparations are the sterile formulations which are used to treat various eye disorders and maintain the ocular health. So they are applied directly to the eye or surrounding tissues. Okay, so here they are mainly used for the treatment of eye infections. Purpose is to kill or inhibit the growth of the bacteria, virus, or fungi in the eye. Example: antibiotic eye drops, antiviral eye drops, antifungal eye drops. And next one is the management of the glaucoma. The purpose is to reduce the intraocular pressure to prevent the optic nerve damage here. Example: beta blockers, prostaglandins. And next one is the treatment of allergic eye conditions. The purpose is to relieve the symptoms like itching, redness, and swelling due to allergies. Example: antihistamine drops, mast cell stabilizers, that is ketotiphins. And next one is the anti-inflammatory uses in order to reduce the inflammation after the surgery or the injury. Example: steroidal drops like prednisone on estates, and non-steroidal anti-inflammatory drugs, NSAIDs, like ketorolac. And next one is the lubrication and dry eye relief purpose. That is another application which provides the artificial tear substitutes in the dry eye syndromes are due to the contact lens uses. Okay. Example: carboxymethylcellulose drops or HPMC gels. Next one is a pupil dilation or constriction. That is mydriatic and myitic effects used especially in the treatment of glaucoma and eye examinations. And next one is the anesthesia. So this is to mainly used during the surgeries, especially numbness. So this is anesthesia is mainly used to create the numbness in the eye before surgery or diagnostic procedures. An example for this is proparcaine and tetracaine in eye drops are used. And next one is the diagnostic purposes. This is used to stain the cornea and measure the pressure or visualize the eye internal structure. Example: tropic mites. And next one is the post-surgical care. So like in order to prevent the infections, inflammations, and promote the healing after eye surgery also, we will use this type of ophthalmic products. Example: antibiotics, steroidal combinations, anti-inflammatory eye drops. And last uses is delivery of the drug to the posterior segment of the eye. So some ophthalmics like intraocular injections are used to treat the muscular degenerations and retinal vein occlusions and diabetic retinopathy. So thank you for watching this video. Please subscribe to our channel for more videos.